How does mental illness lead to violence?
Well, so there's lots of different mechanisms. There is the way that symptoms directly can cause aggression. So we've talked about some of those in the patients we've discussed today already. So people can hear voices, for example, command hallucinations telling you to attack somebody. People can have paranoid delusions when they're psychotic, where they believe that other people are out to hurt them, so they attack them preemptively. So that's the most direct kind of link, I would say. And then you get indirect links. So we mentioned before that most of my patients have some sort of horrific life experience or vicissitudes. So from poverty, homelessness, physical or sexual abuse, drug and alcohol use. All of those factors lead to criminality, and separately they all lead to mental illnesses. So in the cohort that I see, which is a bit of both, then so they have factors that lead to both of those things. So it's like an indirect cause. And then lastly, I would say that some people who are mentally ill get exploited. So it's probably a small proportion of my patients, maybe 5 to 10%. But I've certainly assessed some people who have something like a learning disability or schizophrenia, who are completely marginalised and isolated, and criminal gangs prey on them. So I've assessed several cases where drug dealing gangs have befriended somebody who's just a little bit odd, socially awkward, got a mental illness, and they pretend that they're part of the gang, and they pretend to be pally with them, spend some time with them, but they actually just use them. They manipulate them to like sell drugs on their behalf, so they take all the risk, but the criminal gang take all the benefits, the money.